In the previous video, I talked about the carpal tunnel syndrome, what it is, and what are the symptoms. For example, symptoms such as pain in the fingers, numbness, and loss of strength. I promised that in this video, I will explain the therapy options extensively, because almost 5% of the population of the United States actually have the carpal tunnel syndrome. So the best therapy is actually if you don't need the therapy. Prevention, to prevent the disease or disorder before it develops. So what can we actually do to stop the carpal tunnel syndrome from even developing? Well, the answer is pretty much nothing. It's neither patient's nor physician's fault if carpal tunnel syndrome develops. You see, there are many factors that are associated with the carpal tunnel syndrome. In fact, genetic and anthropometric predisposition are far more associated with the carpal tunnel syndrome than occupational factors such as writing too much or playing a guitar. So we cannot really prevent it, but we can recognize it, diagnose it, and treat it on time. The treatments can actually be divided into two groups: the conservative treatments and the surgical treatments. Let's talk about the conservative treatments. Normally, we first try to alleviate the symptoms with these conservative treatments. So, when somebody has pain in his hand, the first thing that this person might do is try to touch that region, try to shake it, or apply cold. These conservative treatments might actually get rid of the symptoms temporarily. What patients usually notice is that these occupational factors actually initiate the symptoms. It's not that they cause them, but they initiate them. So for example, this person has carpal tunnel syndrome, this patient, and then he's playing his guitar all day long, and then he's like, wow, this really hurts. So occupational factors and activities can initiate the symptoms, so it actually makes sense to take a break and stop doing those activities to get rid of the symptoms temporarily. Occupational factors, which I've already explained, and I said that they don't really cause the carpal tunnel syndrome, can actually initiate the symptoms. So that's why patients usually think that that's what caused the carpal tunnel syndrome to begin with. So patient can, for example, play guitar all day long, and then at one point, wow, it hurts. He notices that it hurts. And actually, it might make sense to stop that activity for a while, and that also might get rid of the symptoms temporarily. Remember, usually occupational factors cannot be described as the cause of the carpal tunnel syndrome. Splints can actually help protect the joint, protect the wrist joint from hyperflexing. For example, when patients sleep, it's possible to flex the wrist joint and actually then sleep on the wrist joint. So splints can be very helpful. Furthermore, patient can try to apply cold ice to get rid of the inflammation and the swelling. On the other hand, heat can be applied to promote blood flow in that region. Painkillers such as non-steroidal anti-inflammatory drugs are indicated, and opioid painkillers are not. You should remember that. Opioid painkillers, stay away from those. If all these conservative treatments fail, if the painkillers fail, we're not going to start taking the opioid painkillers. we will try to inject cortisone injections. Cortisone injections can actually help reduce the swelling and inflammation. And if the cortisone injections also fail, well, surgical treatment can be considered. Further indications for surgery are muscle weakness and muscle atrophy, and also constant static numbness. Those are the indications for surgical treatment of the carpal tunnel syndrome. When we talk about the surgical treatment, usually there are two approaches: the open surgical approach and the endoscopic surgical approach. Let's first discuss the open surgery for carpal tunnel release. Why do we discuss open surgical approach first? Well, open surgical approach was the gold standard for a long period of time. In recent time, endoscopic approach has been improved a lot, but there are a lot of advantages and disadvantages of both of these procedures. So let's discuss both of these procedures and let's figure out which one is better. For an open carpal tunnel release surgery, we have to make an incision. An incision should normally be less than 4 centimeters long. And this incision goes through subcutaneous tissue, superficial palmar fascia, and if present, Palmaris brevis muscle. Then we expose the carpal tunnel, and longitudinal incision through the transverse carpal ligament will expose the median nerve. The release can be continued distally all the way to the superficial arterial arcus and proximally to the wrist flexion crease. The aim here is to have a complete release of the transverse carpal ligament to achieve the best possible results, and do so while avoiding the surrounding structures and avoiding the damage to the other structures in this region. One modification of this open surgical approach is actually the method developed by Syed Issa. In this method, a transverse small incision is made in the crease itself, and that way, a small transverse 1.5 centimeter long incision will heal faster and look better. That's pretty much all I wanted to say about the open surgical approach for the carpal tunnel release, especially the method developed by Syed Issa. Remember, this incision is made in the crease itself, and that actually makes the aesthetics simply better. The scar tissue is not that visible. But what about the endoscopic approach? What about the endoscopic technique, surgery for carpal tunnel release? Remember, we said that in an open surgery for carpal tunnel release, we had to cut through subcutaneous tissue, superficial palmar fascia, palmaris brevis muscle. What if we could actually go around that? What if we make an incision, just a small transverse incision, and then we insert a tube through that incision, and we push that tube and we go underneath this transverse carpal ligament, basically between the transverse carpal ligament and the underlying nerve. We go between there. This tube is called a cannula. It's a medical instrument, and one side of it, in this case the upper side, we would be looking up, is open. So basically, as we insert this tube, we can insert the endoscope in it and look at the transverse carpal ligament up there. We can also insert the knife and cut it. So basically, we go under the transverse carpal ligament, we see it, and we cut it. That way, we actually don't have to cut so many surrounding structures. Fine, so we don't have to cut all the surrounding structures. It's a minimally invasive procedure, so that is the best procedure? Well, not so fast. Disorders and diseases are not always that simple. What if there are surrounding pathologies, things contributing to the compression, things that surgeon would like to fix? Well, we have just a small hollow tube, the cannula, and we have the endoscope. We cannot actually see much. If we cannot see much, then we might damage something if we're not that experienced, right? What if there is bleeding and we don't know exactly where it is, how to stop it? How can we actually stop it if there's bleeding? And what if there is some technical issue with the camera, with the quality of the camera, with the quality of the instrument? This procedure is technically more demanding procedure. So what is the best surgical approach here? Open surgery or endoscopic surgery? It really depends. Maybe there are other things surgeon would like to fix or see, maybe not. Maybe surgeon is experienced with one type of surgery and not the other. So there are a lot of things contributing to this. What if there are technical difficulties at that hospital? Not everybody has premium healthcare access. What if the patients live in a country where technical abilities of these departments and clinics are always under question mark? So considering all these factors, one can decide, a patient can decide which surgery to get. If patient can get a proper, good endoscopic surgery by an experienced physician, then it's a good choice. Also, open surgery, it has been considered the gold standard, and studies have not proven that either of these are significantly better. If you need more help and information about symptoms, then go to Symptomsky.com. There you can find experts and our software for symptoms. If you are studying or teaching medicine, then go to Anatomsky.com. There you can find these animations and 3D models in software I made.